Well, hello. I'm here with Dr. Kathryn Collins of Kissel Eye Care and Neurovision Rehab Center to discuss the topic of neurovision. And it may be a term that's new to you, but more and more it's becoming prevalent in society, whether it's because of us being in front of computers all the time, or in the case of sports and athletics, there's a lot of contact sports that are starting to cause, whether it's head trauma, headaches, and whatever. So, Dr. Collins, thank you for taking the time to explain this. And really, for our viewers, how would you describe? Because we'll talk about more of the symptoms and such. But how would you describe, just basically, what neurovision is? A lot of people hadn't heard of it. I hadn't heard of it until you presented it.
Yes. Neurovision is actually a more detailed eye exam in order to determine whether somebody has a vertical or a horizontal imbalance in their eyes, where one eye is higher than the other or one eye is turned out a little bit more than the other. And it causes a lot of symptoms like headaches, dizziness, panic attacks when they're driving, difficulty working on a computer. It can cause somebody even to feel like they don't want to be out and about, not be able to work, not be able to go out of their house because they feel more comfortable inside, where they aren't going to be exposed to feeling dizzy or falling easily.
Mm-hmm.
A lot of times it's caused by concussions. It can be, someone can be born with this, but there are also other things like viruses and medications that can cause it. Some people have issues with being in crowded spaces, being in big box stores, being around fluorescent lighting, and a lot of these things cause these symptoms that make them feel like they just don't know what else to do and find an answer, and Neurovision helps them find an answer to their solution.
Have you found in your experience with this, and again, it's understanding that it's a new and really cutting edge area, have you found that there are more people who may have been born with it as opposed to environmental or just situational things, whether they're in contact sports or, again, like, working in front of the computer all day, which I'm guilty of?
Yes. Actually, I think that some people might have some issues when they're younger, and it comes out as ADD or having difficulty in school. And so, but it seems like there's some triggering event later on in their life that pushes them over the edge to not being comfortable and not knowing where they are in space. And knowing where we are in space is really critical to not being dizzy. We tend to, if our bodies or our brains are getting the wrong signals, it causes us to go into what's called a fight or flight, and it causes that feeling of being panicky and not knowing where we are in space, and it causes our heart to race. It causes us to feel like we don't want to be in that environment anymore and have to shut our eyes and close down, and that's what the treatment for the Neurovision helps eliminate.
Do you think it would be fair to say that played into the situation with the weatherman in Raleigh, North Carolina? I mean, when you first told me about Neurovision and pointed that out, and I watched the video, and I'm watching him talking about this, he had a panic attack on the air, which is a nightmare for anybody who's in front of a camera.
Yes.
Would that be fair to say that?
Yes, he probably was born with some misalignment of his eyes, and something triggered that event. Driving is another triggering event where a lot of people find that they're in a lot of traffic and get panicky. Sometimes they have what's called disembarkment syndrome, where they get off of a boat or a plane and it triggers an event. Sometimes Lyme disease can cause this triggering event that causes them to be more dizzy and have more headaches.
It just seems like there's all these conditions that it's easy to not think about the fact that they might have something to do with your eyes as
Right.
opposed to something else. Because I think it was the gentleman in Raleigh. He was told, cut gluten out of your diet.
Yes.
And you've mentioned that that you encounter a lot of misdiagnosis when you're dealing with neurovision.
Absolutely. A lot of these patients go through a lot of different doctors. They see ear, nose, and throat doctors. They see vestibular therapists. They're going to the neurologist. They're going to their family doctor. And then they usually turn to alternative medicine. Many patients are finding that massage and chiropractic care help. They are also finding that Botox and those kind of things can help with the headaches. And they just reach a limit where they have been to multiple doctors, multiple testing, multiple blood work, multiple MRIs, and when they find that the answer is their eyes and a simple pair of glasses to help realign their vision solves 80 to 100% of their symptoms, it's a relief to them.
So would you say that in some ways you might be an chiropractor?
I guess so.
I couldn't resist that. Now, two conditions that you've mentioned are vertical heterophoria and binocular vision disorder.
Mm-hmm.
And quite frankly, just from a layman's perspective, binocular vision disorder, it seems like a very vague area. I know it's not.
Mm-hmm.
But it sounds like a vague area. Binocular vision disorder.
Mm-hmm.
Maybe that could be nearsightedness or farsightedness for
Yes.
somebody like me that doesn't know any better.
Right.
But could you describe these two conditions for our viewers?
Sure. Binocular vision disorder is how the two eyes work together. They're not just necessarily one eye and the other eye. Myopia and hyperopia, or nearsightedness and farsightedness, or each eye could be nearsighted or farsighted. But binocular vision disorder are how the two eyes work together, and that can encompass a lot of different things. Some people have what's called horizontal diplopia, or horizontal double vision, where their two eyes are horizontally misaligned, and some people have a vertical misalignment, which is where the vertical heterophoria comes along. And we put prescribe prism in the glasses to realign that misalignment, and it solves a lot of symptoms with patients.
Now, you just beat me to the punch on that one because in these situations where there are misdiagnoses, it would be easy for a layperson like me to think, how is it that a pair of glasses makes that much difference? And this doctor or that doctor, they were doing their best, but not on the right track. And here, a pair of glasses happens. And you mentioned prisms.
Mm-hmm.
And of course, when I think prisms, I think Dark Side of the Moon, Pink Floyd, that iconic album cover.
Correct.
So, how is it that a pair of glasses could make that big of a difference?
Well, basically what prism is a triangle, just like the front of the Dark Side of the Moon album, but it bends light, and it bends the image to land a certain place on your retina. And if the images are misaligned in your two eyes in comparison to each other, we use prism in the glasses, which doesn't look like anything. Nobody would ever even know or see this on your glasses. But it bends light and bends the images so that they land in the same place on the retina. So your brain sees one image instead of two. Seeing two images is very disorienting and causes a lot of headaches. And so a lot of patients don't even understand or feel like they're seeing two. Sometimes it's just a shadowing or a ghosting image, or it feels like the eyes are bouncing around where they can't align.
But it's having an effect on them.
Absolutely. And some people have trouble reading or never being able to read very well or very quickly. Some people have a lot of trouble on the computer, like we said before, or moving from the computer to the printed material. And so this prism bends the images so that you only see one image, and you feel right with the world again.
Well, so you're helping people feel right with the world.
Yes.
And if I may be gratuitous, get the world better in focus.
Correct.
What kind of reactions do you get?
Oh, patients, when they find that this is the answer, sometimes they're angry because nobody knew about it before and they had to find this information out on their own, either by Googling it or searching it or finding out from a friend. A lot of times they're very happy and relieved because they finally found the answer to the problem that they were having. Some people are able to go back to work, start to drive again, spend time with their kids and their family again, where they avoided things like sports events and social occasions because they felt so crummy all the time. And now they're so relieved. I get more hugs and more thank yous than I ever did before.
That's
Tears.
gotta feel good.
Yes. Lots of tears are shed in our office when just the sheer relief of feeling so much better. When you feel like this every day, all day, feeling dizzy and headachy, and no medication and no treatment seems to be the answer, a lot of patients are very relieved.
Well, I want to thank you for putting all this, again, in focus. I'm probably overdoing that. But if any of this is sounding familiar to you, you can take the Neurovision test at neurorehabofpa.com and see if you should schedule your appointment with Kissel Eye Care and Neurovision Rehab of Pennsylvania today. Thank you again, Doctor.